Let me pull up the presentation. Okay, is everyone able to see it?
Yes, sir.
Yes.
Okay, thank you. So welcome to our town hall meeting between the Pulaski County Public Schools and the New River Health District. I'd like to thank Dr. Bissell for joining us today and giving us a block of her time to talk through some of the questions and concerns that we may have about reopening the reopening of our schools in a few weeks. Just a quick overview of the agenda. We'll start off in a minute and let everyone introduce themselves. Then we'll do just a really quick overview of our reopening and health plans. We'll give Dr. Bissell a few minutes to discuss any information that she would like to discuss with us about the current conditions within the New River Health District's area. And then we'll open it up for questions. And the way questions will work is we will go school by school and allow each representative from that school and our student representatives to ask one question, and we'll move on to the next. And then if we have time, we will start another round of questions, and hopefully a lot of the questions between schools are the same, so hopefully we can get most of the more pressing questions addressed during this meeting, and then we'll just follow it up with some concluding remarks. And you know, we are scheduled to for this to end by 10 o'clock, so we'll try to be mindful of everyone's time and make sure that it is wrapping up at 10 o'clock. Okay, with that, let's have everyone do introductions. We'll start with our two student representatives.
I'm Grace Bailey. I'm at Pulaski County High School.
I'm Evan Algier. I'll be a sophomore at Pulaski County High School.
Okay, thank you both for joining us today, and thank you for serving on our task force earlier in the summer. Okay, Kreiser.
Can you hear me?
Yes.
This is Brian Compton. I'm the librarian at Kreiser Elementary. Hello.
Okay, Dublin Elementary.
This is Greg Souter, 5th grade at Dublin Elementary.
Pulaski Elementary.
I'm Kara Etzel. I teach kindergarten at Pulaski Elementary.
Okay, Riverlawn.
I'm Susie Hickman, and I teach 5th grade at Riverland Elementary.
Okay, Snowville.
Amy Parcell, and I teach kindergarten.
Okay, Pulaski County Middle School.
Good morning. I'm Christy Alhauser, and I teach science at Pulaski Middle.
And good morning. I'm Rachel Parker. I teach math at Pulaski County Middle.
Okay, Pulaski County High School.
Good morning. I'm Christy Underwood. I teach career and technical education marketing at Pulaski County High School.
And I'm Philip Bird, and I teach 10th grade at the high school.
Okay, PCEA.
Candy Castelluccio, PCEA president, and I teach preschool.
Okay, our nursing supervisor.
Mary Hall, supervisor of school health.
Okay, school board members.
Good morning. I'm Mary Rash. I work with administration and instruction.
Timmy Hurst with the Pulaski County School Board.
Paige Cash, Pulaski County School Board.
Okay, Sarah and Brenda, you want to go ahead and introduce yourselves?
Sure. I'm Sarah Polch. I'm the Director of Special Education for the schools.
Brenda Crawford, Executive Administrative Assistant to the Superintendent.
Okay, Dr. Bissell.
Hi, Noelle Bissell, Director of the New River Health District.
Okay, thank you all for joining us. We'll go over just a quick overview of our health plan and our reopening plan, just to refresh everyone's memory about what we're looking at for the start of our school year. Regarding transportation, our buses will transport 1 student per seat, and alternate routes and staggered starting and ending times are going to be used for elementary and secondary runs. Masks are going to be required by everyone riding the bus. With our school schedules, schools are going to be open to students 4 days per week, Monday, Tuesdays, Thursdays, Fridays. Wednesdays will be used for virtual learning and school sanitization. Health screenings, employees and students should pre-screen before leaving their homes. Screenings will occur upon arrival for everyone, and scanning thermometers are going to be available in each classroom. Inside of our classroom, students are going to be spaced at least 3 feet apart. Our goal is to get everyone at least 6 feet apart, and we are going to be able to achieve that in some classrooms. In some classrooms we can't, but we still will keep everyone at least 3 feet apart. And if 6 feet of social distancing cannot be maintained, masks will be required. Transitions are going to be reduced. We will have signs and reminders about proper hygiene and mitigation strategies. Students will wash or sanitize their hands before and after using frequently touched surfaces, and outside classes will be encouraged. Our meals are going to be delivered to the K-2 classrooms. It'll be grab and go for all other grades. Meals will be eaten in the classroom or outside if possible. Students will be asked to wash or sanitize their hands before and after eating. And then just some miscellaneous items. Guest speakers are going to be all virtual. There'll be no off-campus field trips. All visitors to the building will undergo a health screening, and air handling systems will run an additional 6 hours per day to ensure that more fresh air is circulated through the building. Okay, our instructional plan that fits in with our health plan, we are going to have a phased reopening. We will have 25% of our students attending each day the first week, and 50% attending each day the second and third week, followed by 100% attendance for all 4 days beginning on September 28th. Because of issues at the middle school site, and the new middle school will not be ready to open when we had hoped it would be, Pulaski County Middle School will be starting with all virtual instruction for the first 2 weeks. Student schedules, elementary students will remain with 1 teacher for all core instruction, and most specials will occur within their regular classroom. Secondary classes will be double blocked and occur 2 days per week, and secondary will have 1 hour of virtual each day, and that's to help provide additional instruction, because we have shortened the secondary day in order to make the staggered bus arrival, pickup, and transportation homework. For covering missed instruction, steps will be taken to bridge the learning gaps caused by school closures from last year. Regarding new instruction, all face-to-face instruction will include the use of the Canvas virtual platform through Virtual Virginia to allow for easy transition to virtual learning. Every K-12 student will be issued a Chromebook, and our administrators and technology department will work with families to make sure that everyone has access to high-speed internet. And student services, services to students and families, all special education, 504 plans, gifted services, school counseling, and other support services will be offered to students whether their participation is face-to-face or virtual. So that's just a really quick overview of what many who are part of this call today spent a couple months trying to put together this summer. And with that, I'll turn it over to Dr. Bissell to update us on what the status of things are in the New River Health District.
Good morning. Thank you all for hosting this. It certainly is an unusual and unsettling time, and certainly we've never been here before. So we don't have a written playbook or plan. You know, we're trying to work this, looking at our resources, and trying to do what we can to get our kids back in school as safely as possible, and still adhering to those public health recommendations. You know, I think you all put a lot of thought into the plan. I think everyone realizes that the plans are going to have to be flexible, and we are going to have to adjust. Right now in the district, the data, if anyone is following the data, the cases are going up. That's not unexpected. You know, the data is good, but we have we have to remember that there's got to be some context there. And unfortunately, when you're looking at numbers on screens, you don't always have that context. And it's really important to keep that in mind. And it's also important to keep in mind that the data is cumulative. So those numbers are never going to go down. And those numbers are not cases per day. Those are total case numbers in a specific locality or in the district. A couple of other things about data. You know, people who follow it every day will ask us a lot of questions. We did have a pretty large data dump within the past several days. So if anyone's following testing numbers, our testing numbers went up significantly. It wasn't that our testing changed significantly, but it was that the computer system, the program that we're using that our results come into has now started interfacing better. They're able to dump those results into the main Virginia system that reports results. Prior to that, none of our negative results were actually going in unless they were manually entered. All of our positive results were going in because we were manually entering them as part of our case investigations. So, you know, the data is good and it gives us some, you know, some information, but again, we have to keep it in context. We have to keep some perspective, and we have to understand that there very much is a nuance to, you know, the local area. You know, as far as our processes, you know, we continue to work, you know, the health department does case investigations and contact tracing with communicable disease every day. This is not a new process for us. It's not something that we're learning on the fly. This is something that we do very well. It's just been highlighted during the 24/7 media and social media coverage of COVID. It always starts with the case. We always do the interview there. Number one, we confirm the case because we actually get a lot of people who go around with things that they've heard or things that they've seen on social media that aren't always confirmed. So the first thing we always do is confirm, and then we do that interview, and then we do the appropriate investigation and the tracing, and we go from there. And again, you know, we put all that information together, and that's where what we use to base our recommendations. In the case of schools, I think everyone is prepared or should be prepared. We will have cases in schools. We have community transmission. COVID is here. We do have community transmission, and until we have herd immunity, it will still be here. And herd immunity is only going to be achieved through natural infection, where you have enough of your population infected that you get that immunity, or through a vaccine. There's lots of media attention to potential vaccines. There are some in their phase 3 of clinical trials, but we are still a ways away from those actually making it to where we can deliver them. And even when we get there, we've already heard a lot of resistance and hesitancy about accepting vaccine that is, you know, relatively new when it normally takes years, and now we're taking that process down to months. The idea of keeping things at a low level of transmission is to keep it manageable and to make sure that we're not overwhelming our healthcare resources, which we are in constant communication with those folks. And you know, that factors into our decision making and our guidance as well. So in the schools, you know, you guys have a great plan in place. And I know plans are plans, and we've never done this before, so we don't know how things are going to flow, and there will be glitches, and we'll have to change things up, and it just takes, you know, emergency response, which is what this is, takes being adaptable and flexible and scalable, and that's what we need to keep in mind, that we all need to be kind of flexible, and we need to realize that things change, that we don't have all the answers. And that we're trying to move forward with the information we have, with the judgment that we have, and do things as safely as possible while still getting the kids back to school, which I think everyone agrees is our ultimate goal. The emphasis on everyone's personal responsibility can't be understated. And that's a big campaign that we're starting in the New River Health District, district-wide. It's called Be Committed, Be Well, and it basically is everyone has a responsibility that we can affect, and we can really control the trajectory of this disease, of the infection here in the New River Health District. And I think we got really, really lax on basic infection control and prevention measures because we hadn't been faced with something like this before. And breaking it back down to those basics goes a long way. You know, simple hand washing goes a long way. Staying home when we're sick, that's critical right now. It's kind of been the tradition that people just kind of tough it out and they go through and they go to work and they kind of go through and do their things. And we have to really reinforce that with all of our staff and with our parents and our families, that when folks are sick, now is not the time. Any time really is not the time. When we're sick, we have to stay home to prevent potentially exposing and infecting other people. If we know we've been told that we should be quarantining or isolating, we need people to adhere to that guidance. You know, the goal is not to blame, it's not to shame, it is just to protect everybody as best we can and to really follow those sound public health principles of how we can manage communicable disease and an infection of this nature. You know, the health screening things are all very important. Encouraging folks not to touch their face, wiping surfaces down, the sanitization. I mean, cleaning things has a role, that the whole deep clean thing, you know, we have to be careful. We don't have the significant fomite transmission. So we want to make sure we clean things well, but it doesn't have to be a ServPro type cleaning. The distancing we know works. So keeping our space, no close contact, not sharing things, those things work. And then the masking, you know, that's become such a controversial and political thing. And again, we have to bring that back to protecting our community. What masking does is it provides what we call universal source control, meaning that if someone has a mask on, if they are infected with COVID or flu or anything else, it prevents a significant number of those droplets from getting out into the air that could potentially be inhaled by somebody else. And if somebody else is wearing a mask, having a mask presents that barrier that decreases the potential of them inhaling those droplets. So it's what we call universal source control, and actually is effective. And we don't want to make it about, you know, political stand or mandates. We want to make it about, this is kind of one small thing that people can do to take care of their classmates, to take care of their friends, to take care of their teachers, to take care of everyone. And, you know, any mitigation strategy alone works well, but when you use multiple mitigation strategies, it works even better. And that's how we have to use it. And we have to recognize that it requires behavioral change and encouraging people, again, not to blame or shame, but really try to educate and encourage people. So, you know, I think looking at where we are in the district, our numbers have gone up. They have gone up in certain areas, but the health department, one thing I will say is that by the time those numbers are posted, the health department has actually already identified the case, done the investigation, done the tracing, done a risk assessment, and implemented mitigation strategies. So, you know, those numbers lag behind what we are actually doing in the health department. And that's one of the disconnects, is people tend to look at those in real time, and they're actually not real time. And I can assure you that we continue to monitor, we continue to stay in communication with our localities, with our hospitals, with our EMS and law enforcement, with our schools, with our community agencies, just to get a feel for where things are and to make sure people are aware. And certainly we will make recommendations based on anything that we feel is a threat to public health in any community, in the schools, or, you know, if we start seeing that our healthcare systems are really kind of taxed with COVID cases. So there's a lot of factors that go into those decisions. And I guess just looking at the numbers, we have to keep that in mind, and also keep in mind that the data lags. So I'm here for any questions. I think this is the time, if people have specific questions, maybe we can address them.
Okay, thank you, Dr. Bissell. And with that, we will open it up to questions, and we will go in the same order that we started our introductions, just so we can make sure we give everyone a chance to ask questions or make comments. And I would like to apologize. I forgot to have Mr. Stafford introduce himself. And since then, we've had Ms. Beckner join us from the school board office. So Chris Stafford, our assistant superintendent, is also participating in this today. And Jana Beckner, our HR director, is participating. Is there anyone else that I forgot? Okay, thank you. So with that, we'll open it up first to our students. Grace, do you have any questions?
I would like to know if there's any extra steps that students or teachers can take, like other than social distancing and wearing masks and washing hands, to make sure everybody stays safe.
So yeah, number one, we want to call it physical distancing because we want you to stay socially connected. We want you to stay physically separated. Again, you know, any one of those works well. All of them together works great. I think that the biggest thing is to encourage folks, number one, if they're sick or they've been in contact with sick folks, to stay home. I mean, that's the biggest thing, because we traditionally don't do that. We traditionally go out and power through. The other thing I will say is about the masking is kind of that positive peer pressure. You know, if we wear a mask, it's really a small thing that we can do to help protect our community, to help protect our friends, our teachers, our bus drivers, and everyone else, and to kind of, you know, make it a community effort and not a divisive thing. We don't want people to be divided, which is what our society tends to be nowadays. So the more of those things you can do, the better. Any one of them is great. The more you can do, the better. The other thing, you know, we tend to want to congregate. So asking people to stay physically distanced is really hard, but you want to keep your social group limited. Now is not the time to be doing those big gatherings of 50 and 100 people. You know, keep your social group limited to your closest friends. You know, maintain that separation and that distance. Use your technology as your ways to stay socially connected. And even in school, you know, just keep some distance. You can still be with each other and chat and have fun and laugh and joke and play, but keep that distance. And then do things outside as much as possible, because outside transmission is much, much less likely than inside.
Okay, Evan?
Exactly how many cases in a school would there be before we would shut it down?
So it depends. You know, one case would certainly not be enough to shut a school down. It may be where we have to have some folks in the classroom quarantine. Multiple cases may not be enough to shut a school down. What we look at when we're trying to make the decision is what we call an epi-link, and how cases are connected by person, place, and time. So I'm not quite sure how big Pulaski County High School is, but for instance, multiple cases in the high school that have no connection are not as concerning as multiple cases in the high school that have a connection of person, place, or time, because then that suggests to us we have a cluster or an outbreak, and we need to find the source of that and address it. So there are no definitive numbers. It is very much dependent on specific situations, and it's dependent on the epi connection, and those connections are person, place, and time.
Okay, thank you. Kreiser and Mr. Compton?
People have said to me that they have concerns over a lot of grandparents are raising our kids in the county, and they have concerns of being grandparents have concerns rather of being more susceptible to COVID. And what can you say to grandparents raising a lot of our students, because they're afraid if they get it, then where do their kids go that they're raising? some of the grandparents could even maybe die from it. So that there were a lot of concerns about that brought up.
I mean, it is a valid concern. This infection is one that kind of spans the entire spectrum, from people who are completely asymptomatic and have no problems to people who get very sick and die. And we certainly know that the people who are at highest risk of getting symptomatic, being admitted and passing away are those who are older, those who have other conditions. I would say that if that's the situation, those might be the people that need to consider, is virtual learning a better option for their particular family situation? I think the school plan does a very good job at mitigation, but we all have to realize that it is mitigation, that there is no elimination of risk. Even with best practices, and we know that this is not, we've never done this before, so we will have our ups and downs, and we are feeling things out. I think the beauty of the plans are that the schools give that flexibility, that people can go virtual, and they can transition between the virtual and in person when need be. But certainly, I think everyone has to look at their own individual risk and their own individual threshold for what risk, which is not unlike what we do every day. Every day we get into a car and we make a risk assessment of what we're willing to accept when we drive from one place to another. So it's not unlike that we have to make that assessment, and we have to decide what's best, for our family. And again, I would just say, encouraging all those behaviors, because they go a long way. They really do go a long way for prevention, even in the home. They go a long way for prevention.
Okay, thank you.
Okay, Dublin Elementary, Mr. Souter.
Yes, Dr. Bissell, what are some primary symptoms or patterns that you're seeing with the onset of this disease? Is it fever? Are you seeing stomach issues mainly? I mean, how does someone know if they're contracting this disease?
I would say that the best way to know is you just don't feel well. I mean, you can use fever, and of course the CDC says 100.4, but
Yes.
what we're finding actually is more people have a lower grade, 99 to 100, so that they don't cross that 100.4. The other thing we find correlates very well is they feel feverish. And I know a lot of kids may not know how to do that, but I think your adults will know, I feel feverish, I feel warm. And then just, not feeling well. And I think that's especially important with kids. If they're not their usual self, if their appetite's down. I mean, certainly the common symptoms of cough, shortness of breath, those congestion and sore throat things, which could be a lot of stuff. So it's really important to distinguish, is this a change? Is this that they're just not feeling well? They can have stomach issues, they can have headaches and body aches, and I was blanking on what I was going to say, headaches and body aches. So, just kind of that sense that something's not right. And the other thing that we know is that this is something that is not going to just get better in 24 hours. This is something that's going to be a little bit more progressive. So if things start to develop, like, maybe I need to just wait and see what's going on. And if I'm better tomorrow, then it probably is a short-term thing. Whereas if things just aren't turning around, that's more concerning.
Okay. Now, are you seeing more asymptomatic cases, or are you seeing people with actual symptoms?
We are seeing probably about 30% who we test are not symptomatic. So it's not a small number of people who are not symptomatic. Now, I will say there's a difference between asymptomatic and pre-symptomatic, and that's an important distinction. Asymptomatic is people who just never go on to develop symptoms. Pre-symptomatic is people who, when we test them, might not have symptoms, but 2 days later they actually develop symptoms. And what the research shows is that people who are truly asymptomatic, meaning they never develop symptoms, their viral loads are lower, and thus their infectivity is probably lower. People who are pre-symptomatic can be infectious, just like the flu. They can actually be infectious a day before they develop symptoms, and that's where we just don't know, right? And it's the very same thing with flu. People could have interacted with folks and actually transmitted it before they get that hit by a train sensation. So when we do our contact tracing, if we have a positive case, we look back 2 days before the test or 2 days before the symptom onset to see if they had contact with people, when they were infectious, before they actually knew that they potentially were infectious. And that's why we really have to stress, in addition to staying home for those who are symptomatic, but we have to stress those basic prevention measures all the time, because you just don't know. So those measures work. If you are practicing good hand washing and not touching the face, and practicing distancing and wearing a mask, certainly indoors and when you cannot reliably maintain distancing. Those things are all prevention measures that work, regardless of whether someone's asymptomatic, pre-symptomatic, or symptomatic.
Okay, thank you. Next, Pulaski Elementary, Ms. Etzel.
The question I was asked was, if a student is sent home with a symptom, a fever, just not feeling well, or something along those lines, would their sibling also be sent home, or would that depend on how that student is feeling?
We don't want to jump too far ahead. So I would say, let's see what happens with the student again. Certainly, if the student is better within 24 hours, then there really is no reason to get way out of control about it. But if the student is getting sicker, then yeah, we need to look at what's going on in the family, and if the sibling's getting sicker, if there have been any exposures. And that's where, you can always call the health department, and it's okay to follow up with the family too, and say, hey, how is so-and-so doing? How's their sibling doing? How's the family doing? Anybody in the family ill? And it never hurts to be on the safe side. It certainly doesn't hurt to be on the safe side as we navigate things. And I think, developing that relationship with your families and that open communication will be really important. And then you can always call the health department and ask.
Okay, thank you.
Okay, Riverlawn Elementary, Ms. Hickman.
Okay, now I'm unmuted. The one question I'll go ahead and ask is, some were concerned with testing. As far as like before we get into school, is it suggested that we get tested, or is there any kind of protocol or anything to be tested before we get into school?
So we actually don't recommend testing before going to school, because what we have to realize is that a negative test is one point in time. So it doesn't really help us, and in some cases it gives a false sense of security, like, oh, I'm negative, I can let my guard down, or I don't need to adhere to things as well. Kind of that get out of jail free, or I've gotten away with it thus far and I'm okay. So we don't. Now, as far as testing, a couple of things. Testing is something that we use, but it isn't the only thing we use. For instance, if we identify a case and we know that there are close contacts and family members, they don't all necessarily need to be tested. We would probably have them quarantined, because even if that test comes back negative, when you interpret a test, you look at kind of that pre-test probability that that test is going to be positive. And if the pre-test probability that test is going to be positive is really high, even if you get a negative test, you may still say, there's a chance this is a false negative, because there's no perfect test. So testing is definitely something we use, but we have to keep it in context, and we have to, look at our circumstances. So a lot of cases, we won't recommend testing, we'll just tell people you really need to quarantine. The other thing about testing, we do have a wonderful relationship with our lab. So when we do test, we get very good turnaround, which is really important to do the case investigation and the contact tracing. And we want to preserve that. So we don't want to flood our lab with unnecessary tests that don't help the public health effort and can hinder it by causing a backlog or using testing. So I know there was a big thing, and this is part of the messaging problem, is that we don't get consistent messaging from above. There's a big thing about testing, and contact tracing. Testing is important, but we have to keep it in perspective. It's not the cure-all to get us out of this pandemic by any means. What's going to get us out of this pandemic is the things we do to protect each other and the behavioral change, because these same things we got very lax on. I mean, studies showed that people washed their hands less than 20% of the time they should prior to this pandemic. Coughing and sneezing, coughing into your arm as opposed to just spewing it out into the open air, those kinds of things. That's what's going to help us get through this pandemic. And it's also hopefully going to help us with flu and other communicable diseases that we investigate every day. It's kind of a collective reset on our behaviors.
Thank you. Snovel, Ms. Parcell.
My question is about the face mask. Some people have done some reading of articles from research, and they were saying that the bandanas, the knitted mask, and the neck gaiters had little protection. Is there any way that the school could restrict students from wearing those? Was the question that I had.
So, again, you're looking at levels there, and obviously an N95 or a surgical mask is constructed to be more protective. When you get into the bandanas and the gaiters, again, they may be a little bit more porous than some of these other things, so more droplets may get through. But if your compliance is better, and the one good thing about the bandana or the gaiter is kids can pull them up and put them down really easily, so they're not fumbling trying to get something around their ears or tied around their head where they might be less compliant. So something that might be a little bit less effective is still effective, but your compliance is greater. Overall, you end up on the positive side of things there. So, and it does depend on what the material is. Obviously, something that's crocheted or has holes in it is not going to be as good as something that's not. 2 layers are better than 1. But I think we're really splitting hairs there. And I think if we can get the kids to buy into that cool gaiter or something that they can pull up over their face very easily, and you get better compliance, overall we'll have more success. And you're splitting hairs about, how effective it is compared to the droplet sizes.
Thank you.
One thing I will say, about these studies and research things, the numbers that are coming out, they're getting pre-printed and they're not peer reviewed, number one. And number two, a lot of them are done in artificial settings. And that's where we run into a lot of problems, because people see things on the internet or they see this study or that study, and it really isn't using, an applied setting. It's a very artificial setting when they're doing some of this. And we have to be really careful about that and how we interpret it.
Thank you.
Thank you. With Pulaski County Middle School, Ms. Parker.
Yes, I had a few questions that were emailed to me. Sorry, I'm trying to pull them up. Well, I'll start easy.
Well, Ms. Parker, if you could just pick one. We're trying to go around so everyone can get the most pressing one, and then we'll go back around after that for additional questions if we have time.
Okay. So
email
what was that?
happy if people want to email others that we don't get to. If y'all want to compile them and email them to me, we can certainly do that as well. And I've done that for some of the other schools too.
Okay. Okay. If a teacher comes to school and doesn't pass the checklist, how will the teacher's students be quarantined until a sub can get there, since we can't double up classes and we have that extreme short?
That's a logistical thing. If the teacher, again, we don't want to get ahead of ourselves. If a teacher comes in and they don't pass that health screening and we need to ask them to go, obviously the preference is for them to quarantine as soon as possible, but we don't want to compromise safety. So putting the students in the room, again, we've got the mitigation strategies in place. So putting the students in the room, kind of, insisting that everybody be masked and everybody maintain their distance, including the teacher, until you can work the logistics out. And obviously, that could be a threshold. If staffing can't be maintained, then that's where we would be in contact. Do you need to close for any reason, whether it's a particular school or, release a group of students because you can't maintain safe staffing? So again, it's keeping that, not panicking, and remembering that you all have a great plan that has mitigation strategies in place. And so if you keep that distancing and people are masking and keeping separated, the risk is much lower and you don't have to rush things through and compromise safety. You can do it in a very intentional and deliberate way to make sure that everyone's taken care of.
Okay, thank you. Ms. Altizer?
Good morning. I have a question that was touched on briefly. However, we do have families that have students in multiple schools. And should, you did address if one of those students should become ill, we should watch their sibling. However, what if a parent is diagnosed with COVID? And should their children then be switched to virtual just to be on the safe side to protect other students, or would they be sent to school and watched further?
No. If a parent is diagnosed with COVID, again, it starts with the case. Anyone in that household is considered a close contact and would be quarantined. So if a parent or a sibling is diagnosed, then we would ask that all the students in that family or in that household, I understand some have students from multiple families in one household, they would be asked to switch to virtual and quarantine.
Okay, thank you. Pulaski County High School, Ms. Underwood?
If we have a student in class who has tested positive for COVID, will we be notified of that positive?
Yes. Department of Education does want notification of a positive case in the school. So there would be notification of everyone at the school. And then certainly if there's a student in a classroom, we disclose as little as possible, but the reality is to do our investigation, we need to know where that student went, who they were in contact with. And so we'll be in touch with the school administration. We'll be in touch with any teachers that student was in contact with. And you'll know. Now, we may not always identify. We may just say, look, we have a student from your class who tested positive. Can you give us the layout of the class? And certainly if we need to say it was this student because we really need to know, we will. But we only disclose as much as we need to do a thorough investigation, to do our contact tracing, and to protect public health. And that will be a challenge because people, for instance, people from other classes who have not been contacted are going to demand to know who it is. Why are you not telling me? Because it's going to hit social media. So we need to control that messaging and in advance let parents know that when there is a case identified, the appropriate people will be notified. And that if you're not notified, that means that your child was not in close contact with this case.
Thank you. Mr. Byrd?
Yes, I received some concerns about the ventilation at the high school. Are there other techniques we can use to help mitigate the spread, like teaching with the doors open or using fans? Would that work?
So, fans, obviously, you have to be careful. I know there's a lot of talk about using fans to suck the air out of the classroom through the window. And that's probably something valid. You don't want a fan just blowing stuff around in there. You want to rely on natural ventilation. Yes, if you can open classroom doors, allow circulation, if you can open windows, it's obviously a facilities thing. And again, you have to look at safety issues too. So anything you can do to improve ventilation definitely helps. But I know that your facilities folks are already looking at what they're doing to circulate the air even better. And I think that's an important thing as well.
Thank you.
Thank you. Candy?
I had a question regarding community spread. In the Farallon area, we share a zip code with Radford, and we also share stores and restaurants and pharmacies. When there is a red flag or issue with community spread in Radford, will that affect or be played into factor with Pulaski, with Farallon sharing many of those same locations?
So, we do report by zip code, and we also report by locality, and we've had people question the data. Why does this number come up to this and this come up to this? And the reason is that zip codes kind of cross borders, right? So, the 24141 crosses Radford to Pulaski and whatnot, So the one thing I will say is the messaging right now is that COVID is there, COVID is here, COVID's everywhere. And these are the recommendations we have. These are the precautions we advise everyone to take. So, my saying, oh my gosh, there's 50 more cases in Farallon, you better not shop in the Walmart in Farallon, that really doesn't do anything to change my messaging, because the messaging is the same. These are the measures that you take to protect yourself. These are the measures that also protect other people. And so again, it's a community thing. And again, we do not want to stigmatize. We do not want to blame, because it's not that people are doing things wrong per se. I mean, this happens. Communicable diseases get transmitted, even if you do the best you can. Granted, there are some people who are more lax than others. And unfortunately, there will always be those people. So what we're trying to do is get the broader community, get that middle ground, get those people that are in the middle to buy into the messaging that we're going to do what we can to protect each other and to protect ourselves. And if I do that, it doesn't matter if there's more cases in Farallon and I go to the Sheets in Farallon or the Walmart in Farallon. If I'm doing those things, then I'm protecting myself pretty well.
Okay, thank you. Ms. Howell, do you have any questions?
No, not right now.
Okay, thank you. Mr. Hurst or Dr. Cash, do you have any questions?
I'm fine, Dr. Sears. Of course, I sat through the tabletop discussion with Dr. Bissell a couple weeks ago, so I'm fine. I'd rather hear from the teachers and folks.
All right, thank you, Dr. Cash.
I concur with Mr. Hurst. I'd rather hear from the teachers.
Okay, thank you. We have about 5 minutes left. It won't be enough time to go around and have everyone do a question, but do we have any questions that weren't already covered that are pressing, and any of you feel that it would be valuable for teachers to know the answers to the question prior to returning in about a week and a half?
Dr. Sears, excuse me, I do. I received an email yesterday from the choir teacher at Pulaski County High School, and we were encouraging no singing, no band playing here for the first few days, few weeks of school until we see how things go. And then we received some information from the VHSL that was directed purely at theater, forensics, and debate. But the research did cite some things for choir and band. Dr. Bissell, what are you recommending for our choir and band students right now?
And I think there are coverings that can be put on the instruments, and the research really hasn't been transmission. The virus isn't being blown out with the woodwind instruments.
Right.
So, you know, with the distancing with the band, you know, I think we're good with that. Choir is definitely concerning because we do know that the propagation of virus is much further with people who are singing. So obviously outside would be preferable. They do recommend at least 10 feet and masking even outside. So I do think that choir might be something that you do put on hold, or if there's any way to do that virtually. I have seen some kind of cool things done using Zoom with choir. I think that is definitely one of the more risky activities, and to wait and see on that is not a bad option.
Thank you.
Okay, does anyone else have a question that they would like to ask?
I do. With regards to our students with more significant disabilities who may not be able to tolerate or wear a mask, how can we mitigate that for the one-to-one paras or the teachers who have to be in close contact to support those students?
So the students who can't wear masks, if we can get them wearing a face shield, they might tolerate a face shield if they don't have that right over their face. And again, it's levels of protection. You know, a face shield doesn't have that barrier right over the mouth, but it and the nose, but it does give protection there. And then the same thing with the teachers who are interacting, you know, masking and even a face shield. We are actually working, because we do realize with some students with disabilities, actually seeing the teacher's face, especially with speech and whatnot, is really important. We are working very hard trying to get some prototypes of clear masks that you can actually see the mouth move and the face. And as soon as we have any of those, we'll certainly make them available to our schools for the folks with the special needs and the learning disability students that need them the most. I don't have a time frame on those deliveries, but you know, if a teacher really needs to have that student see their mouth moving and everything, again, a face shield is better than nothing at all. And then when they can put the mask on, put the mask back on. So it's all a mitigation, and something's better than nothing. And you do as much as you can when you can.
Okay, thank you. I believe we probably have time for one more question, if anyone has one that didn't get covered.
Dr. Sears, I do have a quick question. As we're gearing up to bring back the employees and bring back the workforce, I would like to provide them with as much information as possible. And Dr. Bissell, I was wondering if you had any recommended resources that you would recommend that we provide to our staff in regards to guidelines or tips or anything that would alleviate their fears and concerns.
You know, the VDH website and the CDC website both have probably more information than anybody wants on guidance. You know, I think it's hard because there are going to be pages and pages there, and people can look there. You know, I think connecting with each other is probably the most important thing, and if concerns are expressed, get through and get to the health department. You know, my epidemiology team, we're soon going to have what's called a business continuity team, which is an extension of the health department that will provide resources to people who have questions and concerns. But, you know, I hesitate to tell people to go online and read things. I hesitate to tell people to go following the data, because that a lot of times has the exact opposite effect, in that people get overwhelmed, or they really, it kind of generates some fear. So I would encourage discussion amongst the teachers, amongst the classes, and in the schools, and then reach out to us. And a lot of times, you know, just having that discussion, we can mitigate a lot of fear just with using kind of some common sense and some perspective, and maintaining that balance and the context. Because again, it gets lost. The context gets lost a lot.
Okay, thank you.
Okay, thank you, Dr. Bissell. In closing, I would just like to say, if anyone has follow-up questions, if you would like to send those to me, I will compile them into one list and send to Dr. Bissell, and any responses that we get from that, I will then forward to you to send out to the faculty members or your colleagues at your work locations, or we can just do a general send out to all PCPS employees. Might be the best way to do that. So if you could get me any follow-up questions by tomorrow morning, then tomorrow afternoon, I will compile them and forward them to Dr. Bissell. But I would like to thank all of you for joining us today. I know it's an extremely stressful time trying to plan for the restart of school, trying to reinvent how you have delivered instruction. And, you know, as I said in the email that I sent out to everyone the other day, we really want to try to make this a fun and memorable year. We have, you know, have had the heavy yoke of accreditation taken off our shoulders. So we do have some flexibility to try to be inventive with our instruction and be creative in student assignments, and everyone's going to come in with you know, high degree of stress, high degree of uncertainty, and the classrooms will look different. The expectations for their behavior is going to be much different. They're not going to be in cafeterias with 300 other students at the same time. So anything we can do to help make it a little more fun, a little more enjoyable for our students and for each of you will help this year get off to a successful start. And I have full confidence that we're going to get through this year, and we're going to make it a very good year. It's just not going to be a year like any of us have ever encountered before. But I think when we all look back, we will believe that this was one of the better years that we've had, because we had to learn so much about ourselves and so much about how adaptable we really are as educators, and still moving forward to make you know, education a positive experience for each kid. So thank you all for joining us. Thank you, especially Dr. Bissell, for giving us your time. I can't imagine what your schedule looks like, but I know being able to carve out an hour of time in the middle of a pandemic is greatly appreciated from those of us at Pulaski County Public Schools. So thanks to each of you. I will have this converted into a video, and we will share it on Google, and I will send that out to all Pulaski County Public School employees later today. So thank you all. I hope that you have a good rest of the week, and for our teachers, I hope you enjoy the final week of your summer break. Thank you.